as somebody who's now in their mid-30s, have always wanted children, but I do not have a partner right now, I am curious, what are some steps that I should start taking, or what do I look into as far as my fertility goes?
Well, definitely this is the first step, which is having a consultation with me. Because we're going to go into your whole medical history, making sure that you don't have any diagnoses that would add to you not being able to have a child. But most part, if you're getting periods every month, guess what?
Okay.
Guess what?
Few.
And they're not heavy.
Yeah.
They're not painful. That means that your body is telling you that you can ovulate and that you can have a baby. That's sperm great. Can go ahead and meet that egg and begin the descent into the fallopian tube.
Great. At what age do you feel like I should start considering freezing my eggs?
Definitely by age 35. 35 is this magic number that once we hit that 35 and over, that just means we have a significant increase in chromosomal abnormalities. And so the most popular one is Down syndrome. So if you feel like your mate is far off, if your Prince Charming is nowhere in sight, then I do advise to do egg freezing, especially if that's going to lighten your mental load, because that's what it's about. We women suffer from infertility. I like the word subfertility, because infertility just means like you can't have a baby. But for most of us, really, it's sub-infertility, and being stressed and feeling that pressure adds to the delay in having a child when you do meet that Prince Charming. So egg freezing, I tell my patients that, you invest in your education, right? A lot of us have loans. A lot of us are, your car payments, a house payment. So why not invest in your reproductive
security,
right? In your reproduction. And I think that once you get into it and you kind of see that, maybe it doesn't cost so much. You know what I mean? Like the first step is kind of finding out, maybe that's something that I could finance, and it's on a personal decision to really, freeze eggs. But definitely in my experience and what I see from patients is like literally as soon as you freeze your eggs, it just literally lightens your mental load that we're carrying when we don't even know we are.
Right.
But of course, does every woman 35 and older have to freeze eggs? No. This is just a way to secure that they're going to be more healthy. The chances of that egg is going to be more healthy. But do you have to? No. And that will depend on other factors. But definitely, if you can, I highly advise that.
Some of my fears are definitely around infertility. The word is scary, and I worry as I get older, as years go on, that I become more infertile. Are there ways to test fertility?
Definitely, but I do want to reassure you. So if you're having normal periods and you don't have any pain and they're not heavy, that's a good sign that you have a healthy reproductive tract. But for sure, we can test your egg health. And we can get reassurance by imaging, right? So we can make sure that your ovaries and that your fallopian tubes and your uterus is doing okay. But I just want to reassure you, if you don't have any diagnosis of heavy bleeding, which we would think like fibroids or painful periods, which we would think of the fancy word endometriosis, but definitely I would do a full workup on you, because I just want you to decrease your fears and I want to decrease your anxiety.
Thank you.
I am so happy and I'm thankful that you are here to share your story, because your story is a lot of women's story. And so it takes courage to kind of open up and share with it. So I thank you for that. And so the next steps would be to book a consultation with me on Ask Dr. Kendra. And there we're going to come up with a game plan. And we're going to make it simple, and it's going to be stress-free. And I will be there every step of the way for us to evaluate your fertility.
Thank you so much.